Hey guys, happy Friday. I apologize if you can't hear me very well. I'm a little under the weather. I'm sure there's a lot of people under the weather. But we're excited to be back. We have some really cool things going on here that we're excited to talk to you about. But today we're going to talk to you about what is it like for a cosmetic surgery. I know you guys have been over in the spa the last couple of times and you've seen tattoo removal and you've seen, peels, body contouring, injectables. But what if you're considering cosmetic surgery? So what is it like to come in and speak with Dr. Downs and Dr. Viscardi? So today we're going to talk to you about cosmetic surgery and how a consultation would be step by step going at the Center PC, as well as we have an exciting announcement at the end that I get to tell you about. If you guys have any questions, comment them below. Today's surgery that we're going to be talking about ranges from $7,000 to $8,000. So just so that you know the price range for that. And again, if you have any comments, let us know. Here we go. Hey guys.
Hello.
How are you today?
Good. Good. So this is a consultation we're going to do with Kelly. Kelly's our patient today. And we're going to talk a little bit about tummy tuck, or what we would call abdominoplasty. And there are different formats for abdominoplasty. We can do an extended, we can do a regular abdominoplasty. So all of what we do depends on what we're trying to achieve, and each patient is different, each problem is different. So what we would normally begin a consultation is trying to get a little idea of the patient's goals, what the problem is, where they would like to see themselves at the end of this process. And then we can talk a little bit about what that process would be, what it would entail, what the risks where it would be, the benefits, what the surgery would look like, and so on and so forth. So.
But the room we're in today, this is our consultation room, correct?
This is our consultation room. We have several exam rooms. Typically, this would early on would take place in an exam room. This room is a different room because we do a lot of our photographs in here. And behind me, you'll see the Vectra, which is a three-dimensional imaging device that we can use for a lot of cosmetic procedures to try to get at least a handle on patient expectations, what we can do, and then give the patient a little bit of an idea of what the results might look like. But before we get into that, what we would normally do is just talk to the patient a little bit or find out a little bit what the patient's goals are and what they're looking to, what got into this point. So let's start with Kelly. Kelly, what brought you here to talk about a tummy tuck?
I had, over the past year or two, I'd lost a significant amount of weight. I lost about 125 pounds through diet and exercise, and left with excess skin on the abdomen. I've also had 2 kids, so I have a separation of my rectus muscles, and led to my abdominal contents kind of spilling forward. And after working out and getting the body back that I wanted, it was frustrating to me that I could never just get that flat tummy that I always wanted. So that's kind of what drove me to that, and then just the excess skin.
Okay. So, yeah, and that's probably what we hear from a lot of patients. The tummy tucks typically are something that people seek after childbearing, because it stretches out the abdominal skin, changes where the abdominal muscles are, and basically can really change the whole configuration of the tummy area. Tummy tucks are a surgical intervention to help correct all that. So your past medical history, any significant issues for you? Not really, right? You're
Not
pretty
really.
healthy otherwise?
The only medication I take is for thyroid. That's
Okay.
it. Don't take any other medications.
So Kelly's a good candidate. She's a non-smoker. She is healthy. She works out every day. She has a lot of extra skin left over from both childbearing and weight loss. And those are the typical reasons why people seek out abdominoplasty.
Now,
So,
Dr. Downs, I have a quick question. You said non-smoking. Can someone who's a smoker have a tummy tuck?
you have to abstain from smoking for 4 weeks prior to the tummy tuck at the minimum. So people that are actively smoking cannot have a tummy tuck. And the reason for that is that the smoking, the nicotine in cigarette smoke is what we call a vasoconstrictor. It cuts down the blood supply to the skin. So when you think about what we're going to do within the tummy tuck, and we'll explain this as we look at Kelly's tummy, we're going to elevate skin and we're going to, it's basically becoming what we call a flap. a flap of skin. And it's going to depend on that circulation to heal and be healthy. And if you're smoking, statistics show that your rates of non-healing go through the roof if you're actively smoking. So 99% of plastic surgeons across the country will not do a tummy tuck on someone who's actively smoking.
Good to know.
So yeah. So let's have you stand up. So we'll try to do this in a way that's so okay. So we'll hold it. So this is typical. So we've got some stretch marks here, some striae from childbirth and pregnancy, and this extra skin. So there's a lot of extra skin. But what I want to point out with Kelly is the fact that she's got this tummy bulge. And some people come in and say, "Ooh, we got a liposuction because I have this bulging tummy." Well, there's no fat here. This is muscle, and this is from babies. These rectus muscles that used to live right here split apart like that. So if we would have her lie flat, say on a bed or something, and lift her head up off the bed, there would be a big, you could put your fingers in there, there'd be like a valley almost. So so this is a great example of somebody with all this extra skin, and there is nothing you can do to exercise that off. Then
or body contouring.
You can't body contour this, and the stretch marks are indicative of collagen damage. So that in and of itself, this skin is going nowhere. Now after weight loss, if you give it, skin is 6 months, it's elastic, it can snap back to some degree, depending upon the amount of weight loss. Kelly lost about well over 100 pounds, so this skin is going nowhere.
And it's been about a year since I've lost the weight.
Okay, good. So what we're going to do with her is you got to get the skin. This is what we got to do. So in a tummy tuck, this incision goes where, like for instance, a C-section would be, only lower. Scar. So she has a C-section scar there. So what we're going to do is come a little bit below that, and it'll be hidden by any bathing suit, underwear that she wears. And for her incision is going to come up about hip bone to hip bone. And then what we're going to do is undermine all this skin. We're going to go up underneath all this, all the way up to her rib cage. So this all gets elevated. Once that's elevated, we're going to take these muscles and we're going to sew them back together with the suture. So her tummy flattens out like this and holds all those organs back in. That's what she means by her tummy organs spilling out. Because there's not enough strength there. There's not enough muscle tone to hold them back into place. So they go. So, if she were to lie flat, obviously that wouldn't occur. So when she stands up, they push out. We're going to fix that. So part of a tummy tuck is fixing that. And then we're going to pull all this down. So all these stretch marks you're seeing, her stretch marks reach all the way up to here. They're going to end up down here. All this skin below her belly button is going to go away. Now sometimes people don't have this much skin and there's a little vertical from where the belly button was. But in her particular case, we'll get all this skin out of there. And then we bring the belly button. Everybody asks, well, what happens to the belly button? We leave it right where it is. But when we move all this skin away, we bring it out through a new hole. So we'll make a nice little innie for her. It'll be a little oblong, youthful belly button, teardrop shape. And then we'll bring all this down, and we pull down and in. And she has nothing over here, so we don't have to worry about liposuctioning any on their flanks or anything. So she's going to have a great result. It'll be a metamorphosis for her because this is all going to be gone, and it'll be nice.
Okay,
and
so
all this will be
I have
gone.
a couple questions.
Okay.
They're blowing up. Okay, one of them is they want to know what's the difference between a tummy tuck and liposuction, as well as if they can have a tummy tuck and lipo together, as well as I have another one that says important to maintain stable weight after a tummy tuck, ? And another one wants to know how much. I can answer that one. The tummy tuck ranges from 7 to 8,000. So that I answered that one.
You can have liposuction with a tummy tuck. Sometimes we liposuction the upper area. It all depends on the individual. Sometimes when you have that extra skin, you have a little bit of extra on your flanks. You get the tummy nice and flat, and all of a sudden you see the flanks. So we try to identify that ahead of time, and then recommend if you need a little touch up, a little contouring liposuction on the flanks as well to help the midsection. But liposuction accompanied with tummy tuck is very, very common. So you can do the two together. They're different though. Liposuction is just removing fat. We can tighten the skin a little bit with liposuction, especially with the laser-assisted liposuction. But when it gets to this point, there's absolutely no. First of all, she has no fat to liposuction, so that's not even an issue for her. But even if she had some there, I would still say, yeah, we can improve things with liposuction. But if you want a nice flat tummy and you don't want any skin hanging down, you're going to need a tummy tuck. And really, that differs from person to person. And the only way to know that is really to have us take a look at you. What was the other question?
How important is it to maintain stable weight after a tummy tuck?
Anything we do, you have to have a stable weight. I mean, the last thing in the world we would want to do with her is do a tummy tuck and then have her gain 50 pounds. Or if, we do a tummy tuck on someone doesn't have a 14% body fat. If you have a higher BMI, your metabolic index, your percent fat, if you have a higher level of that on your body and you do a tummy tuck and then you lose a bunch of weight, the same thing's going to happen. That tummy skin's going to loosen up. So what we usually use as a guide is about 10% of your total body weight. So if you have more than a 10% fluctuation in your body weight, that could affect your cosmetic outcome. So anything we do, whether it's a tummy tuck, breast augmentation, facelift, any kind of surgical intervention for cosmetic purposes, stable weight is critical. Yours has been stable for a year, which is important. We do a lot of this we do a lot of these types of surgeries on people that have had massive weight loss, either naturally or through a bariatric or surgical approach. And we always ask them to have at least 6 months to a year of stable weight before we do that.
Someone just asked what are the risks and side effects,
Okay.
and can you do a tummy tuck and breast lift at the same time?
Yes. It's a lot of questions all at once. So this is you're jumping ahead on the whole consultation. So we know what. So let's just go to the next step. Kelly's a good candidate for an abdominoplasty, a tummy tuck. So what is that, and what are the risks? And okay, how do we do it? So I already showed you on her tummy where the scar would kind of be. So it kind of goes from hip bone to hip bone. It may go, in some patients, a little longer. It might be a little shorter. Either way, we try to keep it low enough where it's hidden by revealing bathing suits or underwear or anything like that. Those scars start out kind of red. They're visible, but then they fade, and it takes about 12 to 18 months for those scars to fade. The surgery takes us about an hour and a half to 2 hours long. It's done as an outpatient, so you come in, you have it done, you go home. There is a drain usually that's involved that comes out at about day 3 or 4 post-operatively. It's a relatively uncomfortable operation. We're tightening all her muscles, so it's not so much pain as it is tightness and discomfort. We do use a medication that we inject at the time of surgery. It's called Exparel. We usually show this to our patients. We give them the option of using it. We can inject it right into the muscle fascia, and it really gives them pretty good pain relief for about 72 hours instead of using a pain pump or something along those lines. So that's all. We use all these things to help keep you as comfortable as possible. Bottom line, however, is it's a very, very doable operation, and it's very easily controlled with oral pain medicine. As far as risks are concerned, we always talk about generalized risks of surgery and then risks that are specific to this particular type of surgery. So when we talk about this particular type of surgery, we talk about the scar. That's the big one. And also there'll be some numbness to the skin. If anybody's had a C-section, they'll know that right above that C-section scar, sometimes the skin stays a little numb. Well, when we do a tummy tuck, there's numbness to the abdominal skin. Most of that comes back, sometimes not all of it. Sometimes a little patchy area above the scar stays numb or tingly. That usually goes away over time, maybe a year or two. We always talk about wound healing problems. We try to optimize wound healing. For instance, what we spoke about, not smoking, that's huge. Making sure nutrition is optimal. Somebody who's just lost 100 pounds may not be nutritionally optimal at that point to have surgery. They're still what we call catabolics. They're still losing weight. Their body's still trying to heal itself internally rather than expend all its nutrients to try to heal a large incision. So we want to make sure you're on a stable nutritional basis. We want to make sure that mentally you know what you're getting into. It's a process. It's a big operation. There's a recuperation time from this. But really, from a tummy tuck, those are the major specific risks. Now, there's general risks of surgery. Risks of infection. Risks of infection for a tummy tuck is less than 0.1%. We give prophylactic antibiotics, which means antibiotics before surgery. Bleeding, we're not working around any major blood vessels. We're not worried about anybody bleeding to death or anything like that. But we're going to have a little area there that's open. It's a pocket of that can collect either with fluid or blood, little blood that oozes. That's why that drain is there. If for whatever reason a little collection of blood does occur, that's called a hematoma. We would be able to easily drain that out or aspirate it. So those are generalized risks of surgery. We talk about that with everybody. We talk about this is a general anesthetic, so you're asleep for this. So there's risks involved with that. They're minimal. They're very minimal. There's risks of deep vein thrombophlebitis, pulmonary embolism. Anytime we put somebody on an operating table, there are those specific risks, and we would go through those with you. And those risks differ from person to person. The higher the body weight, the higher those risks start to become. So we would, have that discussion with people, each individual. So those are the main risks. But overall, it's a pretty safe operation.
Yeah.
We do a bunch of them.
What would be Kelly's downtime?
Okay. So your downtime is really dependent upon a couple of different things. Your recuperation time is going to be based on what you do for a living. For instance, you are a nurse, you work, you walk around, you don't do any heavy lifting, so from a job standpoint, you're probably looking at about 7 days, 7 to 10 days. The drains will be out, you'll be moving around. You're not going to be moving at light speed, you're not going to be turning cartwheels down the hallway, but you'll be able to do your job. In terms of strenuous activity, like what I would consider heavy weightlifting or aerobic level intensity exercises, anywhere from 4 to 6 weeks. We don't want to have you do anything that increases your heart rate or blood pressure, because that's going to increase your swelling, and when your swelling increases, your healing slows down. So we want to make sure that all that is optimized for you. Now, obviously, if you're a longshoreman and you're unloading trucks on the docks all day, you're not going to be out for a week to 10 days. You might be out 2 to 3 weeks for doing stuff like that. So it all depends on the occupation in terms of that. We do have you wear a garment. We have a compressive garment that looks like a girdle, so to speak, and that goes on. We have you wear that for about 4 weeks. The first 2 weeks, we're going to have you wear that for about 24 hours a day, except when you shower, and then for the second 2 weeks, about at least 12 hours a day, and that's designed just to manage swelling, basically. Like as I said before, the drain stays in about anywhere from 5 days is about average. When it comes out, you're not going to like the drain. Everybody complains about the drain. It's a little grenade-looking thing. You have to carry it around. We have one in the drawer somewhere in here. It looks something like this, and it hangs out. Everybody complains about it, but I have to tuck it in somewhere. But that's pretty much it. Yeah, I mean, it's a tummy tucks. As far as going forward long term, there isn't any long term problems in terms of having a tummy tuck. If you're young and you're worried about getting pregnant, I think that you
Probably should wait.
You probably ought to wait to have a tummy tuck until after you're sure you're done having children. However, sometimes that's not practical, and sometimes you don't know. So having a tummy tuck will not interfere with being pregnant. Your skin will stretch like it normally does. But if you get pregnant again, there's no guarantee of what's going to happen in terms of needing some touch up or something extra down the road for that. Now, the only other thing that's pertinent long term for tummy tuck is that after you've had a tummy tuck, it takes that option away, the tummy option away from breast reconstruction. So women that get diagnosed with breast cancer later in life, and they're looking at surgical options and reconstruction and things like that. There are plenty of other options to do. It's just that would then not be one of them. So that's just another thing to consider long term as well. So what questions do you have?
You pretty much covered everything.
So typically what we'll do for her is we'll set her up for a surgery time, and then we do what we call our informed consent appointment. It's a very prolonged appointment. Well, I won't say it's prolonged, it's about an hour. And we'll sit down, and we have a little packet of information that we'll go through with you. We'll go through it page by page, from getting ready for surgery, what to expect when you arrive, how to take care of things afterwards. The whole thing is laid out for you. You'll have all your prescriptions ready, so you have that at home. We'll do that, and then after that, surgery. Maybe if we're lucky enough, we can peek in on her surgery while she's having that. That would be kind of a fun thing to do.
Are you ruining my surprise I have for them?
Was that a surprise?
Yeah.
Oh, sorry.
Jeez. Do you want?
Yes, I ruined the surprise.
Do you want to quickly tell everybody what the vector is? Because
Okay,
they're
so
wondering.
They're wondering what that is?
Yeah, because they're seeing it. So
Yeah, so the Vectra 3 is a three-dimensional imaging, and we can image you in 3 dimensions, and then we can look at you from different angles. This is a tester because we're going out over the airwaves here, so we don't want to. But if there were no clothes on, we would be able to do that. And for instance, for breast augmentation, we can try out different implants and see what they might look like for sizing purposes. We can annotate, like draw where scars are going to be. We can do body contouring with liposuction, show you what fillers might do for your face. We can image rhinoplasty surgeries. We can actually show you the surgery right here on the computer, and it's really pretty cool way of educating you in terms of what your surgery is going to be and what your expectations might be. Now, we all know from Photoshop that we can do most anything. We can put big dog tongues on people, things like that. But that's not what this is. This is not Photoshop. This is very accurate. I mean, it's not 100% accurate. I mean, it's a simulation, but the results that we simulate here realistically correlate with our surgical results almost 90%. So we're very pleased to offer Vectra, and now it's become kind of like our cell phone. I mean, I'm old enough to remember time before cell phones, but now that I have a cell phone, you can't walk out of your office without it. It's attached to us, I think anatomically. That's the way this has become for us in cosmetic surgery in terms of using it and trying to educate and also plan surgery. So that's the Vectra. It's really a pretty cool technology that we use routinely.
cool. All right, you want to say anything else?
Do I want to say anything else?
Yeah. Anything else you want to?
Yeah, Merry Christmas, Happy Holidays. This is a great time of year. Nobody's ever busy this time of year. So it's fantastic.
Kelly,
Enjoy it.
are you excited about your surgery?
Excited?
Do we have a date for you?
We do.
Next Thursday.
Next Thursday, so we're going to be there. We'll go out and tie one on the night before and be all hungover when that's cool. And this, like I said, this surgery takes, for her, someone with very little body fat, it'll take us about an hour and a half to do her surgery. So it'll make a huge change for her. And here's the thing: when you think about it, either whether you've lost a lot of weight, either through weight loss naturally or through bariatric surgery, you go from one bad body image to another bad body image. You're healthier, you're thinner, you're in better shape than ever, but still that you look in the mirror and you're not happy with what you look like. And that's really what this is all about in terms of getting you back for expectations. And the other thing about expectations when you're considering cosmetic surgery, whether it's abdominoplasty or anything else, you got to do it for the right reason. You're doing it for yourself. Don't do it because a loved one wants you to do it. Don't do it because a boyfriend wants you to do it. Don't do it because somebody else says, hey, why don't you go do that? You need to do it for yourself because it's a and as you'll see in the surgery and the whole process, it is a process, and nobody enters into it lightly. So if you're considering cosmetic surgery of any kind, just keep that in the back of your mind.
Cool. All right.
All right.
Okay, guys, that's it for today. If you,
Time.
I know, and
Shayna has a cold. She's got medicine head. Everybody feel bad for her. That's why the tissue's in her left hand.
Sorry, guys. Only if I knew where I could find a doctor. But so if you guys want to have a really cool surprise, Kelly has granted us to film her surgery. So this will be our first Facebook Live surgery. So if you're interested in watching this surgery done, it's going to be on Thursday, December 22nd at 11 a.m. So again, this Thursday at 11 a.m. If you do have a weak stomach, or if you are, be quiet. If you have a weak stomach or you don't handle blood well, then I do tell you, do not watch. This is a difficult surgery. So again, Thursday, 11 a.m. That means we won't do a Facebook Friday. It'll be on Thursday this week. Also, if you're interested in cosmetic surgery, we do have a special going on. We have 5% off until the end of the year. You have to have your surgery by end of January. And we also have financing options. So if that is one thing that you are interested in, you can go to Care Credit. And we do offer Care Credit. It's on our website. So if you go to financing options, that is something. And you can give Chris or Renee a call at 574-968-9300. 9100. Again, that's 574-968-9100, or visit our website at thecenterpc.com. We hope you have a great weekend, guys, and we will see you Thursday. Bye, guys.
Merry Christmas.
Woo!